everyone, I'm Yoonjung's channel. Today we will have a time to learn more about high blood pressure. That 1 in 3 adults in Korea suffer from. Have you ever heard of high blood pressure at a medical examination? Or does anyone in your family take medicine because of high blood pressure? High blood pressure is called the silent killer because it quietly destroys our bodies without any symptoms. But if you watch this video through today, you'll understand perfectly how to prevent and manage high blood pressure. To give you a brief description of the table of contents, what is high blood pressure? Causes and risk factors of hypertension, symptoms and complications of high blood pressure, how to diagnose hypertension, managing high blood pressure as a lifestyle, cures and medications, prevention and Q&A. Let's start now. Part 1. What is hypertension? Let's see what blood pressure is. Blood pressure is the pressure applied to the walls of blood vessels. When the heart is pumped, it's like the pressure on the wall of the hose when water flows through the hose. Blood pressure is expressed in 2 numbers. Systolic blood pressure above number pressure when the heart contracts. Diastolic blood pressure number below pressure when the heart relaxes. For example, if your blood pressure is 20/80, that means your systolic blood pressure is 120 and your diastolic blood pressure is 80. Normal blood pressure standard. Normal less than non-20/80. Pre-hypertensive stage 120, 1 for 3980, 89. Stage 1 hypertension 140, U15 990, 99. Level 2 hypertension 1 skin to 100 or higher. About 30% of adults in Korea suffer from high blood pressure, and the rate increases as we get older. More than half of people in their 60s and older are hypertensive. But why can't my blood pressure be high? If blood pressure is consistently high, excessive pressure is applied to the walls of blood vessels, causing damage to the vessels. This can damage important organs such as the heart, brain, kidneys, etc. Part 2. Causes and risk factors for hypertension. There are 2 main types of hypertension. Primary hypertension. It accounts for 90–95% of all hypertensive patients, and no clear cause can be found, but it's known that a number of risk factors work in combination. Key risk factors. Unadjustable factors. Age vascular elasticity decreases with age. Gender men are at higher risk than women based on premenopausal women. Genetics. A family history increases the risk by 2 to 3 times. Race high incidence in African Americans. Adjustable factors. Obesity risk increases significantly when BMI is above 30s. Smoking nicotine constricts and damages blood vessels. Excessive salt intake. Risk of eating more than 6 trees per day. Lack of exercise direct impact on cardiovascular health. Stress. Chronic stress causes blood pressure to rise. Excessive drinking. Dangerous if you drink more than 2 cups a day. Secondary hypertension. High blood pressure caused by certain diseases or drugs, which accounts for 5 to 10% of the total. Key causes. A kidney disease. Endocrine diseases, hypothyroidism, Cushing's syndrome, etc. A vascular disease. Certain medications such as contraceptives, steroids, cold medicines, etc. Sleep apnea. Especially at a young age, my blood pressure suddenly rises a lot. If you don't respond well to medication, you should suspect secondary hypertension. Part 3. Symptoms and complications of high blood pressure. Symptoms of high blood pressure. The reason high blood pressure is called the silent killer is because most of the time, there are no special symptoms. Many people think that if you have a headache or dizziness, your blood pressure is high, but that's often not the case. Occasional symptoms. Headache, especially the back of the head. Dizziness. Blurred vision. A nosebleed. Difficulty breathing. A throbbing heart. But these symptoms only appear when your blood pressure is very high. Most hypertensive patients don't feel any symptoms. That's why regular blood pressure monitoring is important. A complication of high blood pressure. Neglecting high blood pressure can seriously damage various organs of our body. Cardiovascular complications. Coronary artery disease, increased risk of myocardial infarction 3 to 4 times. Heart failure to pump blood properly. Aortic dissection, a life-threatening emergency. Cerebrovascular complications. Stroke 7-fold, increased risk of stroke in hypertensive patients. Vascular dementia, cognitive decline due to cerebrovascular injury. Kidney complications. Chronic renal failure, slow decline in kidney function. Proteinuria, protein leaks out of the kidney to urine. Eye complications. retinopathy, risk of vision loss or blindness, a retinal hemorrhage. These complications are difficult to reverse once they occur, so prevention is the most important thing. Part 4. How to diagnose hypertension. An accurate blood pressure measurement. Blood pressure changes throughout the day, so accurate measurements are important. Correct measurement. No smoking, no drinking, no caffeine from 30 minutes before the measurement. Measure after stabilizing for more than 5 minutes. To sit comfortably in a chair with a backrest. Your arms are at the same height as your heart. The cuff size is about 40% of the arm's circumference. Use average after 2 to 3 measurements at 2 to 3 minute intervals. Precautions when using a home blood pressure gauge. Recommended use of brachial blood pressure gauge, more accurate than wrist. Regular comparison verification with hospital blood pressure gauges. Record your measurements and consult your doctor. Diagnostic criteria. To diagnose hypertension, measure twice or more on different days and have an average blood pressure of 14T90 or more. Just one high measurement doesn't mean high blood pressure. A 24-hour active blood pressure measurement is sometimes required. Suspected high blood pressure in the clinic. When the difference between home blood pressure and office blood pressure is large, if you need to check your blood pressure at night. Part 5. Managing high blood pressure as a lifestyle. You can lower your blood pressure by 10 to 20 millifaramed just by improving your lifestyle. This is equivalent to the effect of one blood pressure medication.